All right, we are going to start off with a motion palpation assessment of the patient's spine, cervical spine. So we're going to start off with rotation, and I am going to overpressure each segment: occiput C1, C2, C3, C4, C5, C6, C7. Feeling for infield. Do that on both sides. And then I'm going to check for lateral flexion. So I'm going to tip the patient's head over and I'm going to feel for joint closure at each of those joints. Do that on both sides. And I'm going to check for extension. I'm going to tip the patient's head into extension. I'm going to overpressure each of the segments. All right, then you're going to move on to the adjustment. He has a left rotated C2. The patient is going to be seated. Doctor is going to be standing behind the patient towards the side of dysfunction with my ipsilateral foot forward. My contact hand is going to place the distal interphalangeal joint on the posterior aspect of the left C2 transverse process. My thumb is going to be on the cheekbone. My wrist is going to be straight, parallel with the floor. My indifferent hand is going to be horizontal, oriented with a slight vertical orientation to help induce lateral flexion, going down to the level of C2. I'm going to tip the patient's head into lateral flexion. Then I'm going to tip the patient, or then I'm going to rotate the patient's head. I'm going to come around, but still staying behind my work. And my line of drive is going to be P to A.